Let me back up a bit and talk about the theory and what we're trying to accomplish. Community medicine is all about everything you never learned in medical school. All right? And so my whole hope for you over the next 36 months as you're with us is for you to see the power and the necessity of working outside the exam room towards patient health. You see, in medical school we learn all about the stethoscope medicine, one-on-one in the four walls of the exam room. And this is almost invariably a tertiary intervention. Disease has already been expressed. I mean, sure, we have our share of wellness visits and preventive guidance and anticipatory guidance and all that stuff. But what I'm talking about is identifying the social determinants that allow for the expression of disease and working with the groups of people around these social determinants to improve their situation or to ameliorate their impact on disease expression so that they never have to come to you. I mean, that's the obvious. We're all born with an innate sense of health or wellness. And then we get off this trajectory because of some societal or social milieu in which we find ourselves that allows for disease expression. Diabetes to be just, a recent epidemic. I mean, we're the same people we've been for the last 2 millennia. And yet all of a sudden we have an explosion in diabetes. And it's not worldwide, of course, it's just in some industrialized countries. And it's because of the food chain in which we've set up for ourselves. It's because of the culture of convenience, so that we no longer have to exercise our bodies. Consequently, while the disease might have always been potential, now it's potentiated. And you and I, in the exam room, are hammering away at hemoglobin A1Cs when we really, I think, should try to work ourselves out of a job by working on issues that are allowing for this expression to begin with, you see? And diabetes is just one example. You could go to violence, chemical dependency, asthma, CAD. I mean, you name any disease, basically, and you can trace it back to social determinants. Now, I'm teaching a classical way of approaching community medicine, and we call it community-oriented primary care. This is an acronym we call COPC. Community-oriented primary care. It has 5 basic components to it. Okay, fairly straightforward, but you'd be amazed at how infrequent these components are attended to.